Okay, this is gonna hurt just a little bit.
Jeff Ellis is at the doctor's office today, getting a unique and somewhat controversial treatment for depression. Jeff is here because he wants to smile again. He wants to know what happiness is like again. He wants to know what not wanting to kill himself is like again. Jeff is bipolar and has suffered from depression that has stolen much of his life. Jeff has been hospitalized at psychiatric facilities, taken every kind of antidepressant and mood stabilizer. Nothing worked. Somehow he was able to consistently stay employed, most recently as an NFL football analyst for the Sky Network. Then about a year and a half ago, everything fell apart for Jeff, and he lost his job. He was suicidal, so overwhelmed with despair that he couldn't even drive or leave his house. Then the combination of his daughter leaving for college and his wife losing her job sent him over the edge. Basically, Jeff had what he terms a complete mental collapse.
I sit in front of the fireplace and stretch and try and not feel crazy and listen to music. All I can do is listen to music. I couldn't watch TV. It was too complicated. It was too stressful. Seeing other people's realities was so confusing. It was overwhelming. And no matter how loving my amazing wife is, you're still alone. Mental illness means you're alone.
Jeff says he's not alone anymore. After years of struggling to get better, he's finally found a treatment option in Southern California, here at the Ketamine Clinics of Los Angeles. While it sounds unusual, Jeff's depression is actually being treated by an anesthesiologist. Dr. Stephen Mandel has been in practice for decades in West LA, putting people out during surgery. However, these days, Dr. Mandel is using the same type of anesthesia known as ketamine to treat patients who are depressed and suicidal. Ketamine has been around forever, but this is a new use for depression. It has not been FDA approved for this mental disorder, although there are several clinical trials being researched. Ketamine is widely known on the streets as a club drug, oftentimes used to get high and euphoric. Despite its negative reputation, Dr. Mandel believes ketamine is currently the best treatment for depression.
Most of the patients we see in Ketamine Clinics of Los Angeles have tried everything, or almost everything, before they come to us. They have tried SSRIs, they've tried SNRIs, they've tried atypicals, they've tried antipsychotics. They are what the profession calls treatment resistant. We don't reinvent the wheel. We accept that they're depressed.
What's different about ketamine for depression is that Dr. Mandel gives it in very small doses using an IV infusion.
The standard protocol in ketamine treatment is 0.5 milligram per kilogram over 40 minutes. In this clinic, we use a little more for a little longer. Ketamine has a half-life of about 2 hours and 45 minutes. These effects are lasting for months. We alert patients to the likelihood that color may change for them, that sound may change for them, that line may be a little wavy. They may experience themselves as looking at the situation from outside their own bodies. We reassure them that all of this will end within minutes of the infusion being complete. Most people find this interesting. Some people find it quite amusing. A handful of people find it very unsettling.
Jeff found it worked.
It's been remarkable. It's the look in my wife's face. She looked at me, she saw the smile, and she got the biggest smile I've ever seen in my life on her face as tears poured down her face. It's immoral to withhold ketamine from the general public. There's so much misunderstanding about this, and it's helped me so much. To feel good for the first time in a year and a half is really, really cool.
Patients who are suicidal or who are depressed should have a trial of ketamine.